Hi, I'm Yasmin from Eon Aligner. In this module, I'll be guiding you on strategies that will help you increase patient acceptance in clear aligner treatments. Effective strategies to successfully increase patient acceptance in clear aligners treatments. When patients walk into your clinics, how do you convince them to take up aligners? A guaranteed way to ensure treatment acceptance is to get the patient to trust the doctor and the dental clinic staff. Although educating patients about clear aligner treatments is a critical step, there are several touch points a patient goes through before even meeting the doctor. As covered in the previous module, it is important to optimize all of these touch points, from the patient's first point of contact with the clinic's website or social media pages, to the first call or conversation at the front desk, and finally, their first interaction with the dental assistant before being handed over to the doctor. Now let's move on to the doctor's role and what you can do at each stage to ensure patient acceptance. Number 1, inquire about the chief complaint. Start with asking the patient about their chief complaint or why they think they need to get their teeth aligned. Ask open-ended questions and listen carefully as the patient describes their orthodontic issues. You'll get an idea of their priorities and can better plan your case presentation. Number 2, list and compare the available treatment options. After hearing your patient out, list the different treatment options for teeth straightening and briefly describe each one. You can mention how braces use metallic components fixed to the teeth to achieve teeth alignment, whereas aligners use virtually invisible, removable trays made of clear polyurethane material. You can also mention veneers and how they're used for diastema closure or spacing cases. Compare these treatments and explain why aligners are a superior treatment option to veneers or braces. While veneers are a quick, minimally invasive treatment option, they are limited to correcting only mild teeth spacing and cannot straighten teeth like braces or aligners. You can also point out that oral hygiene is challenging with braces. Patients have to make dietary modifications, and sometimes the brackets or loose wires can impinge on the soft tissue and gums, causing irritation and ulcers. Number 3, explain how aligners work. Next, give the patient a brief description of how aligners work. Explain that aligners use a series of trays to make incremental teeth movements using a constant but gentle force. And depending on the severity of their case, they will have a certain number of aligners steps to wear, and each aligner step has to be changed every 1 or 2 weeks, depending on their case, to progress with the treatment. Number 4, show success stories from Eon Aligner's case gallery. Using the Eon Aligner case gallery, you can show your patients some success stories with before and after photos. This will help develop the patient's trust and confidence in aligner treatments, since they'll have proof of the remarkable results clear aligners can achieve. Number 5, explain the aligner treatment flow. After showcasing the use cases, move on to explain the flow of aligner treatments in a little more detail. Explain that the first step is taking impressions or intraoral scans of their teeth. Highly experienced CAD/CAM designers will then use these records to generate a treatment plan within 3 to 5 days. After approval of the treatment plan, aligner manufacturing begins, and the aligners are delivered to the dental clinic within 7 to 10 days. Mention how your patient will be called in for an initial fitting session and will be given their aligners. IPR and attachment placement will be done in the same appointment if required. Finally, their treatment begins by wearing each aligner step every 1 or 2 weeks, depending on their case. Number 6, give a smile preview. Once the patient accepts and starts the treatment, you can show their end result or smile using the treatment setup on Eon Access. This will help them visualize the final result better, motivate them, and further build trust and confidence in aligner treatments. Number 7, offer flexible payment options. Money is undeniably a make or break factor for your patients to decide if they want to go ahead with the treatment or not, especially with clear aligners, where the overall cost can be overwhelming if you don't have insurance coverage. Be empathetic of the patient's financial barriers, and if possible, offer them flexible monthly payments or quarterly payment plans to cover the cost of the treatment. In order to ease payments, make sure your clinic accepts major credit cards. Number 8, follow up consistently. Schedule regular follow-up appointments to monitor the case and ensure your patient's teeth are tracking well. Faulty records, or rarely a manufacturing error, will cause unexpected issues during treatment. You will have to address or troubleshoot these problems quickly to maintain your patient's trust. You can go through our troubleshooting series on Eon Academy to learn about the issues that commonly arise. In conclusion, optimizing each part of the patient journey, from when your patient makes first contact to the time they walk out of your clinic with their ideal smile, is critical in maintaining high case acceptance rates and ultimately getting referrals from your patients.